Hi and welcome to our webinar, Spine Strategies During the Pandemic. My name is Dr. Yoav Suprun. Thank you for joining me. I am a spine physical therapist, spine specialist here in Miami Beach, Florida. And I was asked to provide you guys with some tips and tricks to save your neck and back during the pandemic period, especially when so many people are sitting at home, looking at their phones, looking at their iPads, watching TV in bed, and are complaining of neck pain, back pain, or sciatica. First, I would like to say that there is a description, whether you're watching us on YouTube or on Facebook. Please take a look at the description on the YouTube video or on the Facebook post with links on how to get further information, as well as we're going to have a Q&A session on May 9th. So would love to have you join us and ask questions if you have any questions after this talk. Please take into consideration, I'm not replacing any medical advice. If you have neck pain, back pain, or any orthopedic issues, whatever I'm saying does not replace the need for you to go see a doctor and have a full clearance before you try to do any of the suggestions I'm giving you in this video. So a little bit about myself. Started my career in 1995 as a personal trainer in New York City. Unfortunately, it didn't take me a long time to become a trainer, and I injured a bunch of my clients unintentionally. I created a little bit of worsening for some of them where they have lower back pain or sciatica or neck pain and stiffness. I thought a lot of stretches that I've given them would help them. And in some of the cases, actually, not only it didn't help, it actually made some of them worse. So when NYU opened their doctorate program in physical therapy, I joined, and it allowed me to put together the knowledge I had as a trainer, and now I had a knowledge of the body, both anatomy and physiology. But even when I graduated at NYU, I didn't feel I was still strong enough in treating people in pain. So I went to work for one of my professors from NYU, and she recommended I'll take a course by a gentleman called Robin McKenzie. Robin was a New Zealand physical therapist who worked throughout his whole career, mainly in New Zealand, but traveled around the world and lectured a lot on his findings. And what Robin, this is Robin and I in New Zealand filming a movie together, what Robin discovered is that the majority of people can treat their own back or can treat their own neck if they know what to do properly. He wrote multiple books, among them Treat Your Own Back, Treat Your Own Neck, Treat Your Own Hip, Treat Your Own Knee, Treat Your Own Shoulder. You can find those on Amazon's. But what the majority of people can really, Robin's finding was that the majority of people can really adjust their own neck or back or hip or knee if they know what to do and what to avoid. So in today's talk, we'll talk about what is it that we're often feeling, especially now when you guys are more at home than ever, sitting on sofas, looking at your iPads, looking at your telephone, watching television in bed, and may experience the following symptoms. For example, if you experience stiffness in the lower back when you get up, or the first couple of steps after you get up, you feel pain in your buttock or down your leg, you may actually think this is muscular, and you would want to stretch your leg, or you may want to stretch your butt, but actually often it is not the leg that is the problem, but a pinched nerve in the lower back causing the electricity to the leg to become obstructed, and as a result of it, you're feeling pain that radiates down into your leg. Now, when I was a trainer, I didn't know that, so when people complained of leg pain, which is actually what is called sciatica, I would recommend certain stretches for them, or to roll on what we call a foam roller to alleviate their symptoms down their leg, but I didn't know that I'm actually just addressing their symptoms and not literally getting into the root of the problem, which stems from here. So I'm now an orthopedic clinical specialist that studied the McKenzie method extensively, and I also teach for the McKenzie Institute International, where I see patients on the stage on monthly basis. We have courses all over the country, And what we're trying to do is to teach the physical therapists, the chiropractors, and the medical doctors that are taking our courses to give them the tools to allow their patients to take care of themselves, because it's important for you to know what to do and what not to do on your own. Especially these days where people are not going to go so much to see a doctor or to see a chiropractor or to see a physical therapist to adjust their neck or back, or a massage therapist. People are interested in knowing what it is that I can do to take care of my own neck and back. So self-empowerment and allowing you to figure out the symptoms you're feeling and what you should do to counteract it is what I'll be talking about right now. So let's start with, first of all, understanding of what the spine position is and the curvatures in the spine. So I'm going to take a spine model here, and here you can see you're looking at the spine from behind. This is the left buttock, this is the right buttock. You're looking at yourself from the front, the belly button is right here. And as I get closer to the camera, you can see these are the vertebrae, the whites are the vertebrae. In between the vertebrae lies the intervertebral discs. These are the nerves that are coming, the yellow are the nerves that are coming out of the lumbar spine. And the same thing occurs up here in the neck. This is the head goes up here, and we have nerves that supply electricity into the upper body. Now, a lot of the time, it is very hard to tell what structure is involved in producing the pain. There could be multiple structures. It could be the bones, it could be the facet joint, it could be the disc, it could be something that grows around the nerve. There are multiple of tissues and structures that could cause pain. However, from Robin's experience and our experience, the majority of you have what we call good and bad days, meaning there are days you can walk and you feel fine and your neck feels really loose and you don't hear a lot of noises and there's no pain radiating down and your back feels good. In those days, those structures in the spine are actually sitting properly. When I say sitting properly, you're probably at a good alignment, you're maintaining this S curvature, and things tend to feel good when we are aligned properly. Now, when do we start to feel problems? And when I say problems, I'm referring to the most common problems. I already described stiffness in your lower back when you get up, but also problems turning your neck, where one day you can turn your neck without a problem, and the following day it feels very stiff. This is a mechanical problem in the neck, something moved out of alignment, it gets close to the nerve, and we start to feel pain. That can be as a result of simply sitting slouched and looking at your laptop for a prolonged period of time, and you're actually moving your head in a forward position called protrusion. And protrusion eventually over time, since the weight of the head is about 10 to 12 pounds, protrusion over time tends to what we call derange or move out of alignment the joints in the neck. And so often people will complain of pain that is stemming from the neck, but we feel it in multiple locations. You might feel it radiating to one side only, or possibly to both sides of your neck, maybe down into your shoulder blade, possibly into your elbow, and even numbness and tingling into your hand. In some cases, some of you may experience the following, where the pain is not going down the shoulder, it's actually going up and you're experiencing headache. These are all what we call mechanical headaches. They're coming from the joints in the neck as a result of them not sitting properly and causing us to feel certain sensations that are, all they are related to poor mechanics, poor ergonomics, and we can fix it often with movement. In the lower back, the following is often felt. We feel the pain starting in the back. Usually, a lot of you have felt the pain starting in the back, and then it started to choose a side. Whether it went down into the right or the left buttock, possibly starting to talk to your front of your thigh or to your hamstring, and maybe radiating down all the way into your foot. In some cases, some of you may be feeling foot pain or heel pain or knee pain or hip pain, And you may think this is the joint that is the problem, but if the pinched nerve is existing in the spine, you owe to yourself to first get mechanically assessed by a trained therapist trained in the McKenzie method to allow you to differentiate what is the pain generator. I can tell you that on daily basis here in my practice on Miami Beach, I'm seeing patients that replace their knee or replace their hip, and they're still experiencing the same level of pain they had prior to the replacement because their spine specialist, or their hip specialist or knee specialist never examined their spine. It is extremely important that before you do any procedure, such as injections of stem cells, or meniscus repair, or injections of cortisone into your hip, that you will first make sure that your pain generator is not coming from your spine. Now, why do we have good and bad days? The reason is because our eyes are in front of our head, right? So this motion is called flexion. And the average person bends forward or flexes their spine about 3,500 to 4,000 times a day, right? What we do is we get up in the morning, we brush our teeth, we wash our face, we shave, we apply makeup, we sit for a prolonged period of time, right, on the toilet. A lot of us are using our phones or iPads in this position. You know, we shave our legs, we eat breakfast, lunch, and dinner, and all these motions over time are flexing our spine. And if you look at your friends or your family members as they get older, a lot of people are actually getting stuck in this position. They're not walking upright the way they used to stand. Now, of course, we don't have eyes in the back of the head, but we rarely move into what we call extension of the spine. Now, some of you may benefit from extension of the spine, but it may hurt some of you, hence the need to get mechanically assessed first. And you will see in the link, in the description, in the bio of this movie, an opportunity to meet with me one-on-one via telehealth to make sure you are doing the correct exercise that's suited for your problem. For example, if someone has what we call a lateral shift, where their upper body is standing to one side, the lower body is to the other side, extensions in standing that I just described will make them worse. So it's important to remember that the tips I'm giving you in this video are just general tips during the pandemic episode when we are sitting more and doing certain things incorrectly. So what else are we doing incorrectly right now as we're stuck at home? So the sofa, for example, let's take a look at the sofa here. I'm going to sit, let's imagine your television is right there, and I'm sitting with my legs in this position. I'm watching a movie, or I'm sitting with my legs on the coffee table, like so. And I'm spending some period of time, maybe reading a book, maybe I'm on my iPad playing, and now as I get up, I feel this stiffness in the lower back, that what we call transitional stiffness. And as I'm getting up, I'm feeling somewhat better, and I'm walking around the house, and within less than 30 seconds, I am walking normally and I feel fine, and that sensation went away, and I'm going for a walk, and I come back home, and now I'm checking some emails, and I'm sitting on my computer, and I'm looking like so, and all of a sudden, when I get up again, I start to feel it's now not so much in my back, maybe it's down into the knee, and my knee is bothering me. If you experience those sensations, it's important for you to know there's a good chance, if you feel stiffness in the back, combined with pain that radiates down into the leg, you are probably dealing with a mechanical back issue and not hip, knee, or what we call the iliotibial band, this band of tissue that runs down the leg. So it's important for you to know how to understand where the pain generator is coming from. And again, if you're not sure, make sure we either meet via the telehealth link that you will get, or you should see in your own town, there's McKenzie therapists throughout the country. You should have a solid mechanical assessment. So what else do we do during the day? We play with family members, play with dogs. We are looking a lot at our phones, we're doing things like so. And so whenever you take the spine and you take it out of its natural S curvature and you start to put it in a C curvature is when I'm sitting like so. Whether it's against the sofa or against the headboard in my bed, the more time I spend in this C curvature, and this is the theoretical model behind Robin McKenzie's invention, the more I'm moving certain structures out of place. And what do I mean certain structures? There is a theoretical model that Robin McKenzie developed. And in his belief, and that started in 1956 when a patient came to his office with sciatica, with leg pain, and Robin sent the patient to go lie in the room. He told him, go to the room, lie down on your stomach, I'll be right there. And what Mr. Smith, a patient, did, he ended up lying on his stomach, but the head of the table was elevated. So instead of lying flat on the table, he actually laid in extension. This is flexion, this is extension. And as he laid in this position for 10 minutes, patient's sciatica started to get better. And when Robin realized it, he started to wonder what could be the mechanism that is contributing to the improvement of this patient. And he started to examine it and started to do experimentation and his theoretical model behind it. And again, this is a theory because there is a disagreement across the world on what structure is involved. Again, it could be bone, it could be ligament, it could be muscle, it could be a growth, God forbid, it could be disc, could be multiple things. But this is an interesting thought that Robin developed. So I'm going to get the spine model close to you right here. And as you can see, here are the vertebrae. Okay, this is a good solid vertebrae, and this is a vertebrae, for example, that has osteopenia and osteoporosis, where it starts to become more porous. That can also be a pain generator. If, God forbid, you're 80 years old and you have osteoporosis and you bend forward, you could fracture, or you sneezed, you can actually fracture an osteoporotic bone. But when Mr. Smith came to Robin, and Robin did his research and findings, this was the theoretical model. So what you're seeing now is the intervertebral disc, and inside the disc there is this gelatinous material and what's called the nucleus pulposus. And in this case, it's not touching the nerves, it's not touching the spinal cord. This is a good day, you feel great, everything feels loose, you're walking around, you're feeling fine, there's no stiffness. And then we are facing this pandemic and we are stuck at home, and you tend to watch some TV show for a prolonged period of time, and you are resting on your sofa like so for, let's say, 45 minutes to an hour, watching a movie. You get up, and as you get up, you are feeling weird. You're feeling some kind of, it's hard for you to walk straight, maybe you're losing your balance a little bit. And so the possibility, again, that's a theoretical model, is that in this moment, because you squeeze something only on one side, now you are dealing with movement of that gelatinous material towards the nerve on one side, and you may feel pain only in your right lower back and maybe down to your buttock. You're feeling this tightness and you kind of rub on it, or maybe you're sitting on a tennis ball. You may feel it a little bit radiating down the leg. You stretch it temporarily. It feels better. But as you're sitting again to eat lunch, or you're watching TV that night in bed, now it's not here anymore. It's radiating into your knee and possibly into your calf. So the theoretical model here is that the gelatinous material has now moved from where it was before, and it's now getting close to the nerve, and it's actually pinching that nerve. If the nerve is getting pinched, it will be hard for the spine to send electricity down to the leg, and as a result of it, you will feel pain maybe in your foot or your ankle, or your calf may cramp, etc. It's important for you to remember that everything in the body receives power from the spine, right? So these nerves have to provide electricity to all our muscles, to our organs. Everything receives, this is the main electricity generator. An order comes from the brain, and now I can lift my knee because a nerve root in my lower back is sending power to the muscle, the hip flexor, and now I can do this. This is a different nerve that pushes electricity to a different muscle. When I'm doing this or this, these are nerves that are coming out of the upper part of the spine. If anything bothers those nerves, if something is impinging on that nerve, we're going to start to feel pain or stiffness or numbness or tingling or hot and cold sensation, and that's when the spine is starting to get deranged. So especially now when we are more at home and we tend to take our spine from an S curvature, which is the nice normal alignment of how we should be in an S curvature, we tend to do more things that take us into this C curvature. We are all sitting like so more than ever. We are all sitting with family members on FaceTime and Zoom, and we're looking into the monitor. So we're doing a lot of flexion moments. So what I would like for you to try, number one, is to try to work on your posture. And how would you work on one's posture? I want you to sit upright as straight as you can, and then let go. And as straight as you can, and then let go, rest. Remember when you were young, you were told by your parents or teacher, sit straight. And we often sit straight for maybe 5 minutes, and then we all want to collapse. The reason is we actually haven't trained our postural muscles to hold us upright. So you want to lift yourself up, wait a few seconds, and then let go. Try to do these 10 repetitions 4 or 5 times a day. And try to lengthen the period of time you're sitting here. Now, you don't have to sit at 100% erect, and you don't want to sit at a 0% slouch. So you want to start moving yourself, just like you're doing a bicep curl. You curl it and you rest it. So you want to curl yourself up and you want to rest it. And after doing 10 repetitions, try to sit at 90% good posture, or 80% good posture, or 50%. Just try not to hang out here. Hanging out in this position over a prolonged period of time creates a phenomenon called creep. Creep is when the ligaments that are between our vertebrae, the ligaments are becoming extremely flexible. And so that's, if you hang out in this position for too long, if the ligaments between the vertebrae become very flexible, you will complain of doing something as simple as bending down to lift the towel off the floor, or taking water out of the refrigerator, and all of a sudden your back will go out. So again, maintaining that alignment as we are sitting will help you while you're hanging out at home, and hopefully at the end of this pandemic you will continue to follow those instructions. Will keep the spine more aligned. I hang out in this position, but I never hang out more than maximum 5 minutes. I always get out of it. I know the danger of staying here for too long. Okay, so the slouch posture and the erect posture and moving between the two, 10 repetitions, 4 or 5 times a day, will hopefully start to help you maintain more of an S curvature, less of a C curvature. Now let's talk about the neck and your ergonomics at home. It is extremely important when you're sitting in front of a computer that your hips will be slightly, as you can see here, I am slightly above my knees. If I'm sitting, this is the lowest this chair can go, and that's actually a good mechanics for me, good ergonomics. My elbows are by the side of the body, and I'm typing like so. If you're working on a laptop and you're doing this, what you're actually doing is you're taking the 10 pounds weight of your head and you're pushing it forward, which will cause the vertebrae in the neck to migrate forward. And as a result of it, think about it. If you move the head for a prolonged period of time forward, here we have a skull, and here are the nerves. If we do this for a prolonged period of time, those vertebrae that are in the neck will eventually, the joints will start to stay in this position. That is why you see some of your family members or friends that are getting stuck as they age. They walk with a forward head posture because no one taught them the importance of what we call retraction of the neck. Now, how do I retract my neck if I'm looking at a monitor? So what can I do? Get your laptop on a couple of 2-3 books, use the monitor of the laptop, but don't use the keyboard. Get yourself a separate keyboard from any store, from Office Depot, from Amazon. Have your keyboard here, and you want to look straight at the monitor. You don't want to look down like so. Same concept with iPads. We don't want to do a lot of this motion as we're staring at the iPad, and definitely not when we're looking at our phones. You don't want to hang those 10 pounds down like so. So when you use your phone, try to create an elevation, have your arm underneath your other arm holding the phone, and try to have the phone at about eye level. Just drop your eyes slightly as opposed to dropping the weight of the head. If you're reading an email, try to read it like so, and if you're typing, try to type like so. Drop your eyes, don't drop the 10 pounds weight of the head, because that will contribute to those aches and pains I was talking about before that will start to radiate down your upper trapezius or down your arm, possibly into your shoulder blade, and maybe go into your head. It can actually cause earache, toothache, funky sensation of sensitivity on the jaw. So mechanics will always help you in maintaining the correct alignment of the neck. So that's going back into correct alignment of neck and correct alignment of back. Now, let's say you get up from your chair and you are feeling stiffness, and as you're upright, you feel better, and you are walking around and you feel great. That means your body often loves extension. So what I would encourage you to try is to either stand against your kitchen counter with your butt hitting the counter, bending backwards over the counter. Try to do 10 repetitions. The first 5-6 may hurt, and again, I'm repeating this again. If you're not sure, this does not replace any medical advice. You should seek a mechanical assessment of your spine to know exactly what is the direction you need to move into. But try the following. See what your effect is. You can also stand with your hands in the small of your back like so. Make sure you're moving your pelvis slightly forward as you're bending backwards, and try to do 10-15 repetitions slowly. Now again, the initial repetitions, you may feel very stiff here. Don't be alarmed, because the majority of people, since we bend forward 3,500 to 4,000 times a day, develop stiffness when they move into extension of the spine. So when we move in that direction, it is common for the initial repetitions to feel fairly stiff. But that is something I would like for you to try. Also, when you're sitting, this is an original Mackenzie lumbar roll. You can find it also on Amazon. There's standard, there's a firm one. Make sure when you're sitting that you have the buttock all the way to the back of the chair. Put a roll in your lower back, squeeze it as far down as you can. Try to maintain the S curvature as you're sitting. Right now, I'm not bothering my spine by hanging in a C curvature. Now, you can also use an empty water bottle. You can roll, you can put a bottle back here, or you can roll a towel and fill up the space that is right above. So the bottle goes all the way in, and then you are using some kind of a lumbar support to keep you upright. Now, if you look at the cushions that are here on the sofa, sitting with this cushion, for example, is too large. That will not hit the lumbar spine. That will hit more beyond the lumbar spine, but this one will be probably better. So when you're looking at your sofa at home and you want to watch TV with some kind of a lumbar support, I would recommend sitting with some kind of a smaller pillow. Get your butt all the way back and try to sit upright. If you sit in a C curvature like so, with your head protruded forward, what's going to happen at the end is that creep phenomena is going to kick in, and you're going to feel this stiffness when you get up. Your neck will bother you, and you will feel possibly radicular nerve-related pain either going down or into the blade or possibly up into the neck. So these are 3 important tips. The slouch over correct, the one you're doing in sitting, the back bends, and the last one, the third one, is to move the head in what we call retraction. Just try to work on moving your head. This is not a motion that human beings usually do. We do a lot of this, whether we brush our teeth or we look at the monitor, we put makeup or we shave. We move our head multiple times a day forward. What I want you to try is to move your head, sit erect, move your head straight back. Think of a really ugly person coming to kiss you. Okay, so you're keeping, don't allow your neck to go up, go straight back and let go. Some of you will experience pain with it, especially in the first couple of repetitions. Okay, and then try to align yourself like so to keep yourself from going into that direction. I would do the retractions of the neck 10 repetitions 5-6 times a day, especially when you're feeling pain. Try to see if just by moving your neck you're able to alleviate or abolish any symptoms that you may be feeling that radiate from the neck down into the upper trapezius or possibly down into the arm. Now, again, you should seek a professional advice and a mechanical assessment to make sure this is the correct maneuver. In addition to it, there's other maneuvers one may need. For example, may need extension of the neck. You may need just lateral flexion to one side only. There's a lot of logic in the McKenzie method, but first you got to get assessed. And once you get assessed, we can find out what is that one exercise that you will need to do. Again, I'll be offering telehealth consultations, 50 minutes consultation. You can find the link in the description of this YouTube video, or if you're watching on Facebook in this post, you'll see a link how to get to the Q&A. We're gonna have a Q&A session coming up on May 9th, I believe. And then if you would wanna see me in person via telehealth, you're gonna be scheduling it directly with Holistic Holiday at Sea. I would like to thank them for inviting me in sharing my knowledge with you guys, and hopefully we can help you during this, with these tips, we can help you during this period of time of less movement. Oh, one more thing I forgot. Walk. If it's safe for you, go outside 5 times a day, 10 to 15 minute walk. Walking is extremely important. We are confined at home and we need to walk more often. So this is the last tip I'm giving you guys. Thank you for watching, and would love to hear your questions in the Q&A session we will do on May 9th. Thank you so much.